COVID-19 has cast the spotlight on mental health at work as workflow changes put the pressure not just on employees but employers too. Now, a study was done for startups specifically, and 150 entrepreneurs were polled. Antoinette Patterson, CEO of digital mental health care provider SafeSpace, joins us tonight to shed light on that study. We'll come to you shortly, Antoinette, but first we'll go through some key highlights. Now, more than half of respondents said running a startup had taken a toll on their mental health. The top factor that stressed them out, having to navigate a challenging business environment. Other factors include cash flow issues, team dynamics, as well as long working hours. Antoinette, the issues seem closely connected to the situation COVID has introduced. But were these already problems before COVID?
Sure. So each startup founder's situation is unique. For this particular section, these were already issues that were seen before COVID. So the point of this research piece is to really highlight and flag that these are already seen in many startup founders based in Singapore, and we want to bring it to the forefront so that we can do something about it.
Right, so this mental toll seems to affect male startup founders a bit more than female counterparts. You'll see a graphic pop up on screen very soon. Why are we seeing this differentiation between male and female?
Sure. So based on the research, we actually found that females were actually a lot more sociable. And the research found was they tended to confide in various social groups that they had. Now, when it came to male startup founders, they tended to keep to themselves a lot more, especially when it came to certain failures that they're experiencing. This could be due to the fact that they do not feel as vulnerable to share their negative situations with other peers. So we are hoping that based on this research that is being published, they can feel that it's okay to not be okay, and to give them the opportunity to feel vulnerable and to confide in a group that they feel safe with.
Right. The study brought up another interesting nugget, and that's that the majority of the startups that were negatively impacted by COVID had solo founders, while those positively impacted had more than one founder. So is this a case of having, someone else to share the load?
Sure. So we definitely, by having a co-founder to share the load, there is someone else to share the stress with and to bounce ideas with and to formulate different solutions together. But this is also applicable when the relationship with the co-founder is a positive one. So for this case, definitely having a co-founder, especially when the relationship is positive, will actually help to reduce the stress.
What about those who don't have the luxury of having a co-founder? Who can they then lean on in stressful times?
Yeah, definitely. So for those who are solo founders, it's definitely possible. For those particular situations, we highly recommend that they find a social group that they can confide in, whether it's friends or family, or should they tend to seek speaking to a therapist. Speaking to a therapist can also help them. It does not mean that they are mentally ill. A therapist can actually help them to actually provide different perspectives to solve a particular situation that they are in. So definitely finding a group that they can confide in or speaking to a therapist that they can trust would be ideal.
Right, so let's look at the impact on employees now. It appears that bosses tended to favor informal conversations the most when assessing the mental health of their staff. In fact, a good proportion also had chats with workers, but a small percentage chose not to focus on it, or they got feedback through surveys. Now, based on your experience, Antoinette, which of these approaches do you think works the best?
Actually, for us, we highly recommend that they do something formal. So doing HR surveys or manager-employee chats would be ideal because a proper structure has been in place. They can formulate the questions that can best outline the ways they can gather information, and they can actually do an action plan after that. So having formal HR surveys or manager-employee chats would be the best situation for them.
Do you think the size of the organization matters when deciding, which approach should be used?
Not at all, actually, because when it comes to mental health issues can occur in any company size and between any kind of co-founder or founder relationship. So the size of the company does not matter. The strategies to implement should be the same across from a startup all the way to an MNC.
All right, and let's finally just focus in on the ramifications, of not addressing mental health issues. What's at stake here?
Sure. So taking a look at startup founders, if we do not look after the mental health of the startup founders, the whole company can crumble because the founder is the leader of the organization. They are the ones that are steering the ship when it comes to managing the company. So when the startup founder is mentally healthy and also physically healthy, they are able to weather through all the storms that they might face. So looking after the mental health should be equally as prioritized as their physical health.
Right, thanks for putting that all in perspective for us. We've been speaking there with Antoinette Patterson. She's the CEO of digital mental health care provider SafeSpace.